And welcome back to Clinical Cousins YouTube channel. Today we're going to go over intra-atrial conduction delays, known as IACDs. Now when talking about IACDs, we need to know that these are simply just EKG findings that indicate whether right atrial enlargement is present or if left atrial enlargement is present. Now, which part of the EKG do we need to look at to find these IACDs? This is a great question. We need to look at the P waves that are in leads V1 and V6. Remember, leads V1 and V6, V1 looks more at the right side of the heart and V6 looks more at the lateral left side of the heart. First, we are going to discuss right atrial enlargement. So the definition that we have to memorize is when the height of the first half of the P wave is taller in V1 than the height of the first half of the P wave in V6, then we say that there is probable right atrial enlargement. Now, why are we looking at only the first half of the P wave that is shown here in blue? Because the first half of the P wave is associated with right atrial excitation or right atrial depolarization, while the second half of the P wave is associated with left atrial depolarization or left atrial excitation. So why are we looking for V1 to be taller than V6? Because if we remember, V1 looks just a little bit more at the right atrium than V6 does. Remember, V6 is very lateral. So let's put it all together. If I gave you an EKG rhythm that looks like this in V1 and V6, what would you say? Well, you would say that the P waves look a little bit odd. You would say that the first half of the P wave is associated with right atrial excitation, and that the P wave in V1 looks just a little bit more at the right atrium than lead V6 does. You would measure the height of the first half of the P wave in V1, and then you would measure the first half of the P wave in lead V6. Then, after you took those measurements, you would have a side-by-side comparison of their heights. You would find that the measurement in lead V1 is much greater than the measurement of the P wave in lead V6. You would confidently say that this patient has the EKG criteria that may indicate right atrial enlargement or a too large right atrium. So, what could cause the right atrium to become so large? Basically, any pathology that will increase the pressure or the volume work of the right atrium. These are pathologies such as COPD, multiple pulmonary embolisms, pulmonary hypertension, tricuspid stenosis, severe mitral disease, or even pulmonary valvular diseases. Now, we've talked about right atrial enlargement, and we know that the formula is if the first half of the P wave in V1 is taller than the first half of the P wave in V6, we know that right atrial enlargement is likely present. Now we're going to talk about left atrial enlargement. Now, all of this seems complicated, but I'll break it down for you. Now, with left atrial enlargement, it is defined as having the second half, remember the second half of a biphasic P wave that has a height and width product that is greater than 0.3 in leads V1 and V6. Whew, that is a mouthful, but let's break it down. Why is this so? Let's talk about it for a second. Why are we looking at the second half of a biphasic or two-part P wave? Because the right atrium depolarizes first and is responsible for this first half here shown in black. And the left atrium excitation is responsible for the second half of the P wave that is shown here in red. Now, why does it matter if the height times the width is greater than 0.3? That's such a random number. Well, when the left atria is enlarged, it means that it has more muscle mass and is full of cells that conduct electricity. We must remember that more muscle means more electricity. Over time, some very smart people have found that having a height and width product or a multiplication product of greater than 0.3 means that there is too much left atrium. meaning that there is too much electrical activity that is occurring from the left atrium, meaning that it is too large. Remember, we're talking about left atrial enlargement. So why are we looking at leads V1 and V6? Because these precordial or chest leads look at the upper portion of our heart, the two atria. So let's put it all together. If I gave you an EKG strip for leads V1 and V6 that look like this, and you noticed that they had biphasic P waves, you would tell me that you need to closely examine the second half of this P wave. Why, I ask? You say because the patient has deep notches in the second half of their biphasic P waves. You explain to me that the second half of the biphasic P wave is associated with left atrial excitation, and that leads V1 and V6 look just a little bit more at our atria. Now let's say that you measure the height to be around 3 millimeters or 3 small squares, and you measure the width to be about 0.12 seconds. You find that the height and the width product, when you multiply the two together, is greater than or equal to 0.3. You can tell me that this indicates that there is a 95% chance that this patient has left atrial enlargement. Now, we have to understand what just happened. What we basically just did is we measured the height of the second half of the biphasic P wave, and we multiplied that by the width of the second half of the biphasic P wave. If that number that you get is greater than 0.3, this is a true statistic. It means that your patient has a 95% chance of having left atrial enlargement. So what have we gone over today? We've gone over the two parts of IACDs. We've gone over the formula for right atrial enlargement, and we've gone over the formula for left atrial enlargement. Please, if you haven't done so already, take the time to write these two definitions down and then commit them to memory. I promise you that it will help you in your path to becoming an EKG master. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.